somebody is on Zepbound or for weight management, is it the medicine which takes care of weight loss, or it's a combination of medicine plus lowering the calorie? And
it is a combination of medication and lifestyle changes which help you lose weight. All the studies which were done on Ozempic, Wegovy, Zepbound and Mounjaro were done with those clients being on a weight loss program. In fact, the licensing of the medication states that you should be on a weight loss program. These drugs are not magic. They reduce your appetite. That's really literally all they do. You have to fight yourself less, because when you start doing these changes, there is a natural instinct that your body has, which is to defend a certain set point weight. When the body has been at a certain weight for a period of time, that it starts considering that to be the normal weight. It's like a thermostat, if your house is always at 16 degrees, that's your normal temperature. If your house is always at 25 degrees, that's your normal temperature. Once you get to a normal weight, your body has a natural tendency to defend a certain set point. And that fight or that struggle is reduced by medications, which are agonists of GLP1 and GIP. So the other reason that is really important that you are on a proper diet and lifestyle while you're taking GLP-1s and GIPs is because of their side effects. The most common side effects of these drugs are loss of muscle. But loss of muscle can happen with any kind of weight loss. It can happen with prolonged fasting. I know people who go to these fasting places, retreats, and they don't eat for 2 weeks. They will lose a lot of muscle. A lot of the weight they're losing is water weight and muscle weight as well, along with fat weight as well. And so adequate protein intake and resistance training is what will preserve your muscle. The second most common side effect of these drugs is constipation, because they slow down the gut motility. And so being active, having adequate fluid hydration, but also adequate fiber intake is also very important for not getting constipation. The third thing that is very common with these drugs is you may have seen the Ozempic face on the news, where people get this very hollowed out kind of appearance, almost like a skull appearance. That's because all the natural collagen and healthy fats, subcutaneous fats under the skin have been burnt off as part of the weight loss. And again, so knowing what supplements to take, and I have a whole talk on supplements, whether it's collagen, hyaluronic acid, omega-3, multivitamins, adequate protein intake, all these things are important. So knowing what to do from a diet, lifestyle, supplement, exercise point of view is important to not just make the drugs effective, but also to avoid the most common side effects from these drugs as well.